Good evening, everyone. Today we'll be discussing about MRI technologies amidst COVID-19 pandemic. First thing that we need to know is what is COVID-19 or coronaviruses. Coronaviruses are a larger family of viruses that cause illness ranging from common cold to a more severe disease such as Middle East Respiratory Syndrome or MERS-CoV and severe acute respiratory syndrome or SARS-CoV. Always remember that this respiratory illness can be easily be spread from person to person, and when a person who has COVID-19 coughs, sneezes, talks, sings, yells, they spray respiratory droplets with parts of the viruses into the air and into the surface. And if a nearby healthy person breathes of the viruses, they can become infected. The common signs of infection include respiratory symptoms, fever, cough, shortness of breath, and difficulty of breathing. In a more severe cases, infection can cause pneumonia, severe acute respiratory syndrome, renal failure, and even death. How does COVID-19 spread? If a healthy person had a contact to a respiratory droplets from an infected person, touching a contaminated objects and surfaces, the virus can enter the person's body, and if they touch an unclean surface with the virus on it and touch their face, mouth, or eyes with an unwashed hands, they can easily acquire the coronavirus or COVID-19. So what to do if you feel sick? Stay at home, get tested, notify the employee's health clinic, take precautions to avoid getting other people sick. So what is COVID-19 prevention plan? Number one would be physical distancing. Stay 6 feet away from others at all times. Try not to overcrowd the workstations, lunchrooms, break rooms, elevators, or vehicles. Try to work in shifts so we can be able to limit the people who are in the workplace. Use drop boxes, limit the number of people in the workspace, take separate vehicles, and avoid touching any surfaces. Second will be the procedures for sick personnel. An employee who is not feeling well or feeling sick should contact the healthcare provider and discuss the COVID-19 testing or get tested. The employee should report the COVID-19 illness to the employee's health clinic so they could do the appropriate action. Report the close contact to your employee's health clinic or have a contact tracing. Proper documentation is needed. Document the symptoms, location, or close contact of the personnel. The personnel is recommended to do self-isolation. He or she should notify his or her close contacts. The unit should clean and disinfect the spaces and the surfaces that the personnel had contact with. Always try to protect the identity of the individuals. As we all know, last 2020, the government nullified patient confidentiality when it comes to COVID-19. Third would be practicing good hygiene. Wash hands often. Add the key moments. What are the 5 moments? Number 1 would be before touching a patient. Second would be before a procedure. Third would be after a procedure or body fluid exposure risk. Fourth would be after touching a patient. Fifth, after touching a patient's surroundings. Use hand sanitizer. Avoid touching the face. Avoid contact with people who are sick. Stay at home when you are sick. Cover when you cough and sneeze. Fourth would be cleaning and disinfecting your workspace. Frequently touch objects and surfaces. Share the equipment between its use. And always ask the infection control unit for the approved cleaning products. Always read the manufacturer's instruction, including the PPEs. In our unit, we do 2 types of disinfection, the high level and the low level disinfection. For the low level, we use the Precept. For high level, we use a machine with Sanasil. Fifth would be the personal protective equipment or the PPE. Face coverings are required. especially in indoors when other people are present, in hallways, stairways, restrooms, and elevators. It is also needed when you're outdoor, when it is not possible to maintain a 6 foot distance from others. Always remember that it's not a replacement for 6 foot distance. Always remember that cloth face coverings do not replace the job of a specific PPE such as medical procedures, masks, facials, respirators, or hazmat. Always make sure that the face is covered properly. Cover the mouth and nose. Do not touch your face. Always wash your hands before and after removing your PPEs. Always wash your clothes. Since COVID-19 is spread via respiratory droplets, extra precaution is being taken and an emphasis is being placed on protecting hospital staffs from respiratory droplets or sputum. Under COVID-19, facial coverings are an infection control and mitigation measures by all hospital staffs and patients. Clothes, facial coverings are not considered PPE by the Department of Health, and everyone is recommended to wear a facial coverings to protect others from the wearer. Today, during this COVID-19 pandemic, you are not allowed to go out without surgical mask. So how do we define surgical mask? It protects others from the wearer's potential infectious respiratory droplets. They are fluid resistant and provides the wearer protection against the large droplet splashes or sprays of the bodily and other hazardous fluid. In this capacity, surgical masks are considered as PPE. It should be placed on a sick individual to prevent transmission on respiratory infection that spreads with the large droplets, or what we call the reverse isolation, and will not protect the wearer against from airborne transmissible infectious or agents due to the loose fit and lack seal, inadequate filtration. No fit tested required. So, as I said a while ago, you cannot go out without the face shield. So, what are the benefits of having a face shield? Face shield protects the face, the nose, the mouth, the eyes. You should cover your forehead, extend below to your chin, and wrap around your face. Disposable face shield should only be worn for a single use. Reusable face shield should always be cleaned and disinfected after use. Goggles or safety glasses needed to be worn under a face shield. And this is a note, it's known that if face shield provides any benefit as a source of control to protect others from the spray of respiratory particles, it means that it's not yet proven. Some people may choose to use face shield when sustained close contact with other people is expected. If face shields are used without a mask, they should wrap around the sides of the wearers and face and extends below the chin. But if you're going to ask me, always use the mask. Face shield is not an absolute protection for us. And if you're using the hazmat or the medical PPE, always use the eye protection. It is important to make sure that the eyes and face protection is put on properly and comfortably so that you are not allowed to adjust it with your contaminated hands or that it may fall during use. When do we use gloves? When you are routinely cleaning and disinfecting. Follow the precautions listed on the disinfectant product label, which may include wearing gloves, reusable or disposable, having a good ventilation by turning on the fan, opening a window to get the fresh air into the room you're cleaning. Possible contact with the bloodborne pathogens. Use of disposable gloves when touching or having a contact with blood, stool, body fluids such as saliva, mucus, vomit, or urine. Do not reuse disposable gloves. What are the steps for donning? First would be the hand hygiene. Second would be putting on the mask. You may use the N95 or the surgical mask. But in using the surgical mask, kindly check if there is spacing between your face. Third will be putting on the face protection. You may use the goggles or the face shield. Fourth would be putting on the gown. Just make sure that there are no exposed skin. Fifth would be putting on the gloves. Use 2 pairs of gloves in putting the last time. What are the steps in dosing? The first step would be removing the gloves. You just pinch the middle of the glove to peel off the first glove. Hold the removed glove in the glove hand. Slide the fingers in the ungloved hand under the remaining glove at the wrist and peel off the second glove over the first glove. Second will be the gown. Pull down the gown away from the neck and shoulders, only touching the inside of the gown. Fold or roll it into bundle. If you're using a disposable gown, you can combine the removal of the gown and gloves in one step by peeling off the glove and at the same time removing the gown. Third will be the face protection. Remove the face protection by lifting the head strap of the earpieces by the back. Fourth would be the mask. Remove your mask. If you're wearing an N95, grasp the bottom of the strap and pull it over the head. Then grasp the top strap to remove the mask without touching the front. For surgical masks, remove the grasping ear loops. And the last would be the hand hygiene. Always perform the hand hygiene after removing the PPE at any point that the hand touch the outside of the PPE. We all have responsibilities. 1. Stay 6 feet away from other people. 2. Do daily symptom attestation if you're working in a hospital location. 3. Stay home. Report to the employee's health clinic and get tested. If you are sick, even if you're experiencing mild symptoms or illness, if your healthcare provider suspects or confirms you have COVID-19, if you had a close contact with a person who has COVID-19. Fourth would be practice good hygiene. Fifth is to clean and disinfect work surfaces and equipment. Sixth, wear a face covering. Seventh, use the required face covering and all personal protective equipment. Eighth, participate in COVID-19 training. We all play roles as a radiologic technologist. What are the roles of radiologic technologists? 1 would be identify the personnel to return to the workplace. 2. Oversee the unit of the site-specific plans. 3. Assignments of COVID-19 site supervisors. 4th, ensure the personnel are trained. 5th, acquired supplies and equipment. 6th, approval of tasks wherein 6 feet distance is not possible. 7th, communicate about the protections against COVID-19. 8th, will be communicate the plan changes. Radiology plays a vital role in COVID-19. Medical imaging plays an important role in supporting clinical decisions, making in diagnosis, management, and treatment of COVID-19 patients. Medical imaging may be useful for differential diagnosis between COVID-19 and other viral respiratory illness with similar symptoms. X-ray section plays a vital role as it gives the initial radiologic assessment of patients presenting with respiratory distress and possible COVID-19 is established. However, the available data on the accuracy of the chest X-ray in COVID-19 is very limited, with similar case numbers compared to chest CT research and often without the inclusion of the normal or non-normal COVID-19 cases. CT scan gives limited but important role in clinical management of COVID-19 patients. CT should be reserved for seriously ill patients with emerging awareness of high prevalence of pulmonary thrombosis. The role of MRI currently in the diagnosis of the further secondary to COVID-19 complications, such as cardiac complications or persistent myositis, is still being explored, and it is likely the application of MRI in this area will expand as we understand more about this disease. Let's always remember that X-ray is for the initial assessment of COVID-19, CT scan is the in-depth assessment for COVID-19, and MRI is the post-COVID-19 assessment. For my references, I would like to thank St. Luke's Medical Center, World Health Organization, Department of Health, Healthcaster, Department of Safety and Professional Services. Take care everyone and always keep safe.